Hey, everybody. TikTok, Facebook, Twitch, my other Facebook, Twitch, Twitter, and YouTube. My name is Jared Budlong. I'm running as an independent candidate for governor in Alabama, and I am doing this ridiculous thing that people don't understand, where I'm running a transparent campaign where I literally live stream as many meetings as possible. Some people aren't comfortable doing that, and I completely respect that. But any of our campaign meetings, like today, campaign policy meeting, we're going to be talking about some ideas for policy proposals. Nothing is completely fleshed out yet. That's kind of the point of these meetings. And some of my team may show up, some of them may not. It is completely volunteer based, so I don't dictate when they show up and when they don't. So we may not have any the rest of the team here today, and we may just look into some random stuff that's been popping in my head and just see if we can get some research done. So we'll see what happens tonight. If you're on TikTok and you have 1,000 followers and you are interested in talking about some policy, I will leave the requests open. If you are on other platforms that you're, if I'm looking here at this camera, that's everybody else, put something in the chat. And you are welcome to put some chat comments in. I'll show those on screen and we'll talk about it live here together. I planned for about an hour. If we end up going over an hour, TikTok won't know a difference. Every other platform, I will have to swap some settings and stuff because I'm using Google Meet in case anybody shows up, and there's a 1 hour time limit because I'm being thrifty with our campaign spending. So, so let's jump into it. So campaign policy, we have three main topics that we're covering with our campaign. We want to talk about healthcare, including both access and quality of healthcare for all of our residents. We want to increase the quality and access to education in our state. And we want to do something about the prison slavery system that we have in Alabama. People don't realize that it's still here, but it's definitely a problem. And I have no problem saying it out loud and talking about it. So that's those are the three major focuses for me. A big point of contention, something that people have been asking about regularly. And since there's people on TikTok that may not be following me, they may not be fully aware. And it's one of the questions I'm getting asked every time I go live. Roe v. Wade. If you have a uterus, I believe you should have access to healthcare, and that includes an abortion whether you need or want it. So we've gotten that out of the way. If you're here and you stick around and somebody asks that question, please reiterate that to whoever's here because I can't always catch all of those comments. But you can use the phrase pro-abortion if you'd like because I'm for it. Not my place as a man to tell you that you shouldn't get that. So anyway, let's jump into some policy. So I had a lot of people ask how I want to pay for things. And in a state environment, taxes are the way that things get paid for as a state. Like if we want to do anything as a state, you have to pay for it. And we do that through taxes. So that's how the state pays for things. So if we're going to help with healthcare, we're going to help with education, we have to do it through taxes. That's how we get money. And Ashbat, I'm going to hit OK. Should be, I'm clicking the wrong thing. Hold on, we actually, some team is showing up, so let me get my mouse over to the admit button. Hold on. We're doing it live. Taylor, welcome.
Hey, sorry, I had to restart my computer.
Oh no, somebody tried to, there it is. Sweet. All right, Ashbat, how's it going? I cannot hear you yet, so I'll say that. Ash, I can hear Taylor. I haven't heard Ash yet. So, there we go.
I'm doing well.
Hearing some noise coming through. Cool. And I need to change the graphic because it says that we told people to stand by still. So I got distracted. Cool. So this is a campaign meeting. It's policy. So TikTok, please use the Q&A feature so that I can actually easily scroll back to an actual question. If you want to chat and have some fun, it's fine. Keep it civil. Mods, if you're in there. We do not tolerate racism. We don't tolerate death threats, and don't block those people. You can mute them unless they're being super problematic. But we typically just mute people.
You can always tag me if it's a problem.
Tag Professor Gemini. Just get their attention so that they can help out because that's my campaign manager.
That's what I'm here for.
Yep. So Ash, do you? Give me some info because I've interacted with a lot of people recently, and I have no recollection of any of the info about you off the top of my head.
Okay, so I have been an Alabama resident, not my entire life. I moved here 4th grade year. I don't really remember how old I was at that time.
It's okay.
I came here from Florida. So I've seen, and I've moved around to several different states. So I've been around several different policies and seen how different states like to handle things.
Okay.
We spoke briefly on TikTok last night
Okay.
about some of my concerns with Alabama's Medicaid program.
Yeah. Okay. Yeah,
And
so,
how they decide who is eligible and not eligible.
Yeah, so that is one of the key three that I mentioned earlier. I don't know if you caught any of the stream before you jumped into the meeting, but like I was explaining to everybody who's watching at home that the three main focuses for my campaign are healthcare, education, and fixing the slavery system we have through the prison system. So if you have knowledge and or a passion for Medicaid, let's focus on that tonight. So, I give us about an hour. We have about 50 minutes of that left based on Google's going to kick us off at 60 minutes. Like they don't care. They warn you a couple minutes ahead of time, but they just chop it off. So we will be spending an hour. And then after that, I'm going to get back to spending some time with my family. So I'll let you start off, because my understanding is the federal government pays a large portion of the Medicaid expenses for us. And we actually have some room to grow. We can accept more, and they still pay for about 90% of that. And it would help us cover, I believe the numbers that I found was another 43% of our uninsured could be insured and have coverage at least through Medicaid. And at this point, that is the extent of my direct knowledge. I am wanting to work with more people who have direct knowledge, so it's less effort to get something to propose to people. So like what a lot of people don't understand is like, in order to propose policy, you have to understand it. You have to understand the intricacies of like how complicated it is, and that's not my area of expertise. So what I'm going to do is do what a governor would do and get people involved who know those areas and let them do their thing, and that's what we're trying to do. So I would love to hear your immediate input on where we're at, so we can take some notes. Taylor, hopefully you've got the meeting notes up.
Yeah.
Perfect. So if you'll take some notes there, that'd be great. And let's go from there. So Ash, where are we at right now outside of not enough coverage?
So to give a little more background on why Medicaid is so important to me, I have a daughter. She just recently turned 3, and she has a rare genetic condition called osteogenesis imperfecta. It's also known as brittle bone disease. And I have fought with healthcare pretty much since her birth to get her that diagnosis. There's a lot of issues within our healthcare of kind of brushing people to the side as hysterical or that they don't really know what they're talking about. And for some reason, if you bring up a concern, they either brush it off or say they'll look into it and then do not. So I talked to her doctor at her first visit, which I believe was at 2 weeks, about her sclera, which is the white of her eyes being blue. And I knew that osteogenesis imperfecta is one of the only diseases where that is present. And he brushed me off and said it should lighten over time and she's probably fine. OI is exceedingly rare. And
but not non-existent. So
yeah. And then at 6 months old, she was in her bouncer and came down funny on her leg. And I knew it was broken. I just had that feeling. And of course, I tried to tell myself, you're probably overreacting. It's okay. She's not acting that strange. She's just not putting weight on it. It could just be like a muscle sprain. So I went to her doctor again, and I asked them to x-ray. They fought with me on that, said they didn't really want to do x-rays. She was so young. They didn't want to expose her to extra radiation. And the thing is, they like to say that so much, but the radiation that you receive from x-rays or imaging of any sort is honestly so small that it doesn't really affect you in the way that they like to pretend that it does.
Yeah, in small doses for the people getting the procedure. So the person receiving the x-ray, it's a small dose. I mean, they put the vest there because it's a good idea, but the people who are doing it every day are the ones that are actually in real danger.
Actual danger, yes.
Yeah. I'm not saying you shouldn't wear a lead vest. Like, don't take that out of context. But it's still a good idea. No. But it's extra preventative measures. It's not that's why the other people leave the room. Like, they go behind a lead wall because they do it every day, and that's when it gets super dangerous. Yeah.
But all they x-rayed was her foot when I had told them it was her entire leg. So of course it came back with no fracture, and they told us not to worry about it. It took me, after that initial 2 weeks thing, I fought and I said, no, you need to send me to a genetic specialist. I live in Northeast Alabama in DeKalb County. So our closest genetic specialist is in Birmingham. So that's a 2-hour drive, which is really difficult on me because I have driving anxiety. But about 2 weeks after that initial x-ray, we finally got to her genetic specialist, and she had a full body x-ray. And it showed positive signs of osteogenesis, but it also showed a spiral fracture, also known as a toddler's fracture, in that leg. So I get a call while we're at Build-A-Bear that I need to immediately come back to the hospital. And I told my husband, I said, listen, this is very common with kids with OI. We are probably going to be questioned because she's not walking, so she shouldn't have a toddler's fracture. A lot of times people will chalk these fractures up at this very early age to abuse because OI is so hard to catch unless you know something about it. And we were fortunate enough that Children's of Birmingham has an OI specialist. And he talked with us and helped us out. And it took us up until, I believe, March of this year to get her diagnosis official. So many trips to Birmingham, visits with an endocrinologist. She also sees an audiologist, ophthalmologist. Of course, her pediatric orthopedic or ortho doctor for her bones and things like that. So she sees a lot of specialists.
Right.
And my husband makes more than what Medicaid considers as far as like allowing you to stay on Medicaid.
Right.
And our rates are so low that if you really do the math, it doesn't equal out to still being able to have an affordable living.
Clarify what you mean there, because I didn't quite follow it. So we went from not being covered by Medicaid, and then you're talking about your rates are so low. Do you mean the rate of enrollment or the cost?
The income limits.
Oh, yeah, okay, gotcha.
So if we make around $40,000 a year, I live with my in-laws because we got to a point where we didn't even have enough money to put gas in our tank to have heat for a winter. So we made the decision to move in with them, which has been great because free childcare. But I believe it's just under $2,500 a month for a 3-person family, and that's not feasible.
Right.
So right now she's been COVID extended, and I'm still in the process of trying to get her onto some kind of affordable health care because our deductibles will come out to be that we're going to go into extreme medical debt to continue her care.
Right.
I have a question, and this is ignorance on my part. Does she not qualify for any special kind of, does she not qualify for Medicaid simply because she has a genetic condition or anything like that?
Yeah, that was one of my big questions with Medicaid. And I did call them and asked if they had special exemptions for children with disabilities. And they told me that I would have to go through the process of getting her on Social Security. But she doesn't qualify for Social Security because Social Security also has an income limit.
Oh, that's that's upsetting.
Yeah. So I, at one point, I injured my back at a previous job and was out on workman's compensation, and at that point, there was a point where I wasn't getting insurance coverage from the job anymore, and I was not at a new job. I was in between, essentially, and because I had been not officially working and making taxable income, I wasn't paying for Social Security or anything else, I could not get approved for Medicaid. Your wife is pregnant, so she gets covered because They want to make sure that pregnancy goes well. So they said, hey, she's covered. Your two kids are covered, but you aren't. Like you haven't made enough to justify giving you insurance, essentially. So thankfully, I am generally a healthy person. Thankfully I didn't get hurt or anything else. But it was like, it's a very similar. It's a weird situation where you can make too little and you can make too much, and then you just don't get help. It's super weird. So like, and for anybody who's watching that hasn't seen me say this previously, like there are things about being a human that you should not go without because you're poor, and those would be human rights for me. So ideally, and somebody asking about a food desert either in the last stream or the beginning of this one, I don't remember because I did one earlier. Somebody asked about food deserts. Healthcare is one of those things, like water, technically. Like I would put housing in that bucket. Like all of those are things that without shelter, food, water, and healthcare, because we don't have a way of doing what would traditionally have been healthcare, because we don't have you can't raise your own medicines and things without property, which takes money. So anyway, all of that stuff I find problematic, that we allow people to be unhealthy and die because they don't have money. So I want to do everything we can to get everybody better access to all of those. Healthcare is super important to me right now because we have so many people that don't have insurance. And I'm not going to say that giving people Medicaid is the only or the best solution, but it is one of the ways that we can help a large amount of people with a little bit of effort. That is supplemented, or not even supplemented. It is mostly covered by the federal government. And that's the part that I'm looking into and need more help with. So I'm hoping people like yourself that want to get involved with the campaign and want to see the state progress forward, even if it's for selfish reasons. Like technically all of this is for selfish reasons, right? We're all people, and I would like to have more dignity as a person. I want everybody else to have more dignity as a person. So like let's all help each other by making society move forward rather than going backwards. So I am looking for meetings like this to where we can discuss the problems and then try to find, at least start stepping towards solutions. So like I don't expect us to come up with the solution in a 1 hour meeting. I know that's not going to happen, but knowing some of those problems, like the income minimum that you can get past, and then the income maximum that you can get past where you're no longer being helped, what are some ways that we can, within the confines of the Alabama code of law and the Constitution, some ways that we can improve that, or come up with a holistic plan. That would be great to propose to the legislators. Like I'm not going to say worst case scenario, but in the scenario where I can't do anything directly, we could come up with a policy that says, hey, we've done the research for you. We've talked to the populace, and here's an idea that everybody can get behind. All you have to do is pass it. Like, hey, House, pass it. Senate, pass it. And then, like, this is my idea, so I'll sign it, right? I say my idea, like it's coming from me at that point. That's one way we could pull this off if it's not something that I can do by myself, which is likely because of the way our state's set up. So a little bit of history and idea, because we haven't been doing these campaign meetings with this structure for I think we've had one. So I want to make sure everybody's on the same page as to like kind of the point of these meetings. And we'll kind of go over that at the beginning of them moving forward. But that's the idea. And sorry I interjected for about 10 minutes. I want to make sure everybody's on the same page on what we're trying to accomplish. So anywho,
I have a couple of questions in the chat, Jared, that I think
are they relevant to healthcare, because that's what we're talking about right now. I can pull them up if they're ones on TikTok. Yeah.
Yeah, they're relevant to healthcare.
Gotcha. Okay. Yeah, go ahead.
Oh, I think no, one said birth control protection if it's not covered by the SCOTUS, and then somebody mentioned that Raven mentioned they're a disabled trans man POC, so just kind of I mean, I don't want to interject in Jared's name, but making sure there are no discriminatory healthcare policies, I think, is a big one for trans disabled POC people. Like that's definitely, I know. But yeah, so I just wanted, those are two healthcare related questions that I wanted to ping at you before diving back in.
Essentially, we need to make sure those get into the notes of what we're putting down for the Medicaid discussion. Healthcare broadly, but medication, Medicaid specifically, because that's the one that we're hoping to expand quickly. The rest of it we'll have to look into further issues. But Medicaid's the one that I know we can do the most easily from what I've heard so far. So, let's put that down as things we need to make sure we're keeping in mind when either we're coming up with a policy to propose or actual, ways that I can make change immediately. Again, I don't want to overstate what my capabilities will be. It's one thing I don't want to do is overpromise something that I can't actually deliver on. So, so we will definitely keep that in mind. Thank you for putting that in the chat.
You're welcome. And I can't respond if it's asked by a Q&A, but I'll say it here.
I can.
Somebody said
civil rights thing, right?
Oh,
well, there was how we support civil rights. Unfortunately, it's going to be putting pressure on the legislature, from what I can tell. Like they have already. It's mainly youth, so we're talking about older people, meaning older than 18. I can push back if they try to pass more legislation that is more restrictive than we've already done. I will definitely be pushing back against that. Part of that is, and it sounds like a cop-out, but it's partially on all of us to elect more local representatives, or the reps and the senators for the state, to make sure that they are not supporting policies that somebody else may be proposing, and maybe even proposing policies that improve your rights rather than just preventing people from taking more. The other one is the printable flyers.
Yeah. I was just gonna say we're about to upload or load those onto the website so you can print them and distribute them at your leisure.
Yep. So those will be up on the website at some point, hopefully sooner than later. Okay, so let's Ash, let's get back to ideas.
Sorry.
Yep, that's okay. So let's we've got a maximum you can make before you lose coverage. You've got a minimum that we can make before you lose the ability to be insured. What are some other concerns that you're aware of that we need to keep in mind when we start looking into ways to solve this?
Ideally, it would be nice to be able to make special exemptions, right? So like places like California, you can have a special exemption for children who have disabilities, or anyone really who have disabilities or have disorders, things like that. You can make that special exemption because they're a high cost issue.
Okay.
Meaning, like in my case, I could say, well, my child has OI. I'm constantly seeing specialists and doctors. Her immune system is compromised, so she's sick very often. I constantly have to take her to get on antibiotics and things like that. So over time, I would be paying an inexorbitant amount of money for basic health care for her. Even if you just look at the amount of times that we go in for things like sinus infections, not including the emergency things, like fractures and stuff like that. So ideally, it would be nice to have a way to say, well, I have this special exemption, please give me help because of it.
Okay. So I don't know how we do it, because we do still have to fund stuff by actual taxes. We're not the federal government that can kind of just literally print money and not without as much concern. We actually have to fund these programs. The ideal world, or the ideal situation in my world in my head would be to not add more exceptions, but literally just broaden everybody who has access to it, rather than saying like, hey, people with this specific condition have extended coverage. It would just, everybody would have better coverage. And again, I'm speaking from an ideal world. We have to look into what we can actually do. Somebody just asked me in the comments, Alabama hasn't accepted Medicaid expansion. That's correct. We can accept more, and the Fed's going to pay for 90% of it. So that is what we're talking about trying to do, and with that, maybe enhancing the Medicaid system that we use in our state along with it. So that's what we're trying to do. And the reason we're having these meetings is to come to a conclusion on what exactly we can do to make that more available to everybody. Yeah. Pay cut for elected officials. So Southern, you bring up a good point. In theory, yes. Depending on the elected officials, it's in our Constitution what they get paid, so it's really hard to change that. It depends on the official, but a lot of things are in our Constitution, and that's why we have 977 amendments, because we put everything in there. So it makes it really hard to undo some of those things. So it's worth looking into. But on the flip side, we could just find other ways to increase revenue. And since we're on the topic of healthcare, we can just bring up marijuana because it happens almost every live stream. Make that decriminalize that and allow that to be a product that can be taxed and bring in some extra revenue. So that's a way we could help start funding some of these systems, some of these programs, and on top of the 90% that's covered by the Fed. That funding is something we can look at how to fund them once we have a plan and know how much we need to fund, right? So we've got to figure out what it's going to cost and then find a way to fund that, rather than trying to find funding and then fitting stuff into that. I would much rather say, here's what we want to do, how much do we need to do it, and then find a way to support that program. That's if anybody disagrees, this is ideally we live in a democracy, so let's chat about it. But that's where my head goes, is let's figure out what we want to do and then find a way to pay for it, rather than let's see how much money we have and figure out how what stuff we have to cut. That doesn't make a whole lot of sense. And before anybody jumps in, I'm not talking about ideally we're not taxing people more. That doesn't make sense, because they're the ones that need it. They need the service. So enjoy. I can't tell you why you shouldn't move out of Alabama ASAP. There are a lot of reasons that I would fully understand. So if it's safe for you to stay here, I would love your support to stay and fight to make this state a better place to live. But if it's not safe for you, I can't blame you for leaving. Anyway, is anybody either in the chat on TikTok, because there's a few people in there, or literally the people that are here in the meeting, does anybody disagree with the idea of coming up with a plan first and finding ways to fund it after the fact?
No, not at all. I mean, the best course of action is to have a plan and then try to figure out how to initiate that plan.
Cool, because that is not, it doesn't seem like how that is normally done. It's, here's your budget, let's figure out what we can squeeze into that and scrap the stuff that doesn't fit. So
plenty of ways that we could figure out how to afford these things. Like you said, with the decriminalization of marijuana, it's already in the state. I mean, why shouldn't we make money off of it and make it safer?
Yep.
And then, same thing with the whole lottery issue.
I'll push back on the lottery every time, and I'll get into it real quick, just because we're talking about trying to fund healthcare, and that could be used for that. Most people want to fund education with it, but no matter what purpose that tax revenue has, the understanding I have of the lottery system that has been implemented in any place I'm aware of, it is predominantly used by those who are already impoverished, and we're using that system to try and improve those people's situation, but they're kind of paying for it themselves rather than doing it as a state and as a society and kind of trying to help everybody. And I don't think that I haven't seen the lottery proposed in a way that I'm comfortable supporting. I understand the concept and the reason behind it, but I think we have better ways, like marijuana or something else. So that's.
Yeah, I understand.
If anybody knows of a way that you can,
if you can find a way,
the lottery
I'm open to it. But
without
it predominantly
predatory practices.
Yeah, predatory practices. There you go. It predominantly is used by those who are impoverished as a way of hoping to get out of it, and that doesn't seem like a good plan to then help them with that money. Also,
it's the same concept as the check cashing places. Payday loans. It's predatory towards poor people, and in a perfect world, a little bit of a cash advance isn't a problem, but when you have predatory practices attached to it, it is. So
I fully agree. So we can move back onto the healthcare. So we'll focus on paying for it later. Let's focus on coming up with a policy first, and we'll figure out a way to pay for it before we implement it. If anybody's trying to make it sound like I'm just going to run our state into the ground, we're going to come up with a plan first and then find a way to pay for it. So anyway, all right. So we have a couple concerns. Then, are we aware of any? So actually, you know what? Somebody mentioned it earlier. I'm glad I remembered it. Medicaid doesn't cover dental, so like that is. Please write that down. Luxury bones shouldn't exist. If it's in your body,
yeah, why
it
are our
should be
teeth and
covered.
eyeballs? Why are our teeth and eyeballs not? I genuinely do not get it. It's part of our body.
Do you want do we want to go into like Jared's conspiratory, like I don't have any proof, but it sounds logical. You don't have to have those to perform manual labor. So like,
oh yeah, that's
like you don't have to have great eyesight to like whack a hammer or work on an assembly line or anything else. Your teeth can be falling out. It doesn't matter. You can still use your arms. I don't have any proof of that, but that's what, based on everything else that I keep learning about our state and our country, that just seems logical to me. Like it doesn't matter. If you make enough, you can then have better eyesight and teeth that don't fall out. That's where my head goes.
I mean, I think that's honestly
that's where I'm at.
Also, what was it? It was like chicken wings. Oh, strange chicken wings. You're in Jasper. You're close to me.
Yeah.
So we can.
You're both way too close to the poop train. So super sorry.
Yeah.
We'll try to fix that later. So we've got to add dental and vision. So we want to make sure that's covered.
Yeah, I added that.
Medicaid for adults because evidently it's covered by kids.
And
so makes sense.
Mental health.
We're in the middle of a meeting and it's got a time limit. Can I help you after this? Well, we're only going to go till 8 o'clock. So why don't you go set a timer and I'll come help you at 8 o'clock. I'm not going to help you with that right now. You can go ask mommy to help you.
Somebody, Southern Fried Fat, you have an answer for Medicaid teeth? Let me hear it. Let us hear it.
I can't right now, buddy. I can't right now. Southern Fried, do you want to? Oh man, I can't. They won't be able to hear you from TikTok. Okay.
I was just saying.
We have enough time though. Go link in bio. Go to my website and go to the events and meetings tab, and there's a link to join the Google Meet. Oh, vision is covered for adults. It's just dental that's not. Cool. Okay, thank you for clarifying, girl. Sorry. Southern Fried, check the events tab, jump in the Meet so that everybody can hear you on the other platforms and not just here. And this is the one that's posterity, like it's kept everywhere. TikTok lets me download it maybe, and I don't want to rely on that. So please jump in the real chat. So we'll move forward. Hopefully we'll get a cool answer or a logical answer. I doubt for the dental piece. So we want dental. Vision's already covered, so that's good. I don't know how good the
mental health care, psychiatrist, and therapy.
Yes, so get those listed on there as well.
Yeah.
Ben, yeah, my kids know I'm running. They knew before the public did. Loud, I love you, dude. You have no idea. It's been nuts the past couple of days. I'm gonna try and stay on topic though. I do get distracted easily, so we got to stay on task. So
that's why I usually answer in the chat.
I used to be able to swipe and get rid of them, but evidently they don't do that anymore, so I can't. Taylor, just tell me if there's comments. Sorry, TikTok. I'm gonna stop.
Yeah.
So we've got mental health. We've got to make sure vision is not just like you can get tests, but make sure people can get like decent glasses. We've got to make sure that they have some kind of not allowance, but is budget the right word for that? For actual eyewear rather than just the test? I can't think of the right word for it. We'll call it an allowance. Whatever. We'll find the right term later. That's not the point of this meeting. We can write the technical terms later. So we've got mental health. We've got eye care, dental care, general body care, and I'm gonna try and let Claire in. If my mouse, I'm gonna have to open this turn this monitor on. Let's see. Come on. Sweet. I assume this is Southern Fried.
Yes.
Sweet. So inform us about the dental coverage, because I was making that up, but it sounded logical, but evidently it's wrong.
So I didn't get to hear what you said about your theory behind it. I was setting up the Google Meet.
Oh, gotcha.
But so my profession currently is I'm actually a medical biller.
Okay.
So this is what I do every day for a living. Medicaid operates under the assumption that patients that are adults that are eligible for Medicaid are also early qualifiers for Medicare. An early qualifier is somebody younger than the age of 65 and does not have end-stage renal disease, which is basically stage 3 and higher of kidney failure.
Okay.
If you have Medicare coverage, Medicare allows for limited dental coverage. You get so much dental coverage per year. It's not much. It's actually a very laughable amount.
Right.
So most Medicare patients end up going places like the UAB School of Dentistry where they get discounted services.
Gotcha. Okay. Yeah, I guess I was thinking more broadly, not Medicaid or Medicare, but thinking about insurance in general, where it's usually not, it's assumed to be an extra. It's like, oh, you want to cover your teeth. It's like,
It
yes,
is.
yes, I would.
There's been times where I had to provide my own dental coverage. And there's I think the only place you can actually purchase a private plan at this time is, who was that? MetLife, I think it was the only place I could find that I could purchase an individual dental plan.
I think you can do it through things like, not that this is a good solution for the problem, but you can get it through places like Colonial Life and stuff like that, I think.
If you are Medicare eligible, but if you are in your 20s, there's a very limited market.
Gotcha.
Because the assumption is, oh, you're young enough to get a job that has dental plans.
Gotcha.
And I've worked for places where all I had was like the emergency was called a limited indemnity plan, which is basically if I get to the emergency room, they'll cover up to $150 a day. That's actually allowed in the state of Alabama. It's disgusting.
Wow. Things don't surprise me anymore. Like I just keep finding atrocious things about our state, and it's still bad, but it's becomes like, oh, yep, no, another thing. Got it. Okay. Like add it to the list of things that we need to look into. Cool. And it's frustrating because people are like, man, can you look at, people bring up a ton of different subjects, and I'm like, yeah, no, like that sucks. Fully understand. But like, I literally, if I don't focus on a couple of things, nothing will get done well. So like, I hate it, but we've got to pick a couple things. And for me, I'm the candidate at this point. Like those are the three things that matter most. We've got to get people educated, and we've got to get them better healthcare and keep them from being put into a slavery system. And all three of those for me tie. So,
yes.
All three of those are related. So I'm gonna stick with those three. And if I can help with infrastructure, or I can help you have better internet speeds, like we will do our best. We might tie one of those into education, but
Alabama actually does fairly well when it comes to balancing their books every year. They're obsessed with it. But the problem is that they don't really want to spend the money. The money that they actually spent during the Malfunction Junction renovation project, they'd actually had that for years in the bank and never touched it. It wasn't until the grant was about to expire that they finally did it, and they did it all at one time, which caused all the problems that we had.
yeah.
But the issue is we have the largest, most convoluted tax code in all 50 states.
Because it's in the Constitution.
Mm-hmm.
A lot of it, maybe not all of it, but a lot of it's in the Constitution. So like, if we wanted to change it, we literally have to get the legislature to propose a change to the Constitution and then put it on a ballot for the public to approve. And
right.
If they don't want that to happen, they put it on, I don't know, a primary ballot, like they did the park funding this year. It was on the primary elections was when we had the park funding to give more funding to state parks. It was, we got to adjust the Constitution. Let's put it on the one where 25% of the population shows up. Let's do it there. It's ridiculous.
So I have a question for Claire. I'm not sure if it has changed, but the transparency in which places bill, how they bill for different
Oh, yeah.
medications and things like that. Is there anything that we can do, to your knowledge, that there's more transparency and it's easily accessible for people to know what they can expect to pay for different procedures?
Unfortunately, there's not. And that's the reason why the chatter on that ended so quickly when it was brought up on a national level, because the general rule of thumb in the industry is that the provider or the facility is going to charge an average of 33% more than what their highest paying contract offers. So if, let's say, United Healthcare versus Blue Cross Blue Shield of Alabama versus Medicare. Let's say Blue Cross Blue Shield pays the most on something. Let's say they pay $6,000 on a hospital stay. Then they're going to charge the $6,000 plus an average of 33% more. That's about a third. On top of that, as the so-called list price. And those contracts change from year to year. Sometimes Blue Cross Blue Shield of Alabama might be the highest paying. Sometimes it's going to be United Healthcare that's the highest paying. And it's really subject to the insurance companies as far as what they offer in the contract, as far as who is the highest paying fish. What patients can do, though, is that they can ask for a self-pay price. And that's usually going to be a discounted amount. Most cases, I've seen it where it gets adjusted down to whatever the highest paying insurance is. You know, again, instead of paying $13,000 for a hospital stay, you might pay $6,000 for a hospital stay. That's not, don't quote me on that. That is not the average price.
You're using rough numbers. Yep. Gotcha.
Right. Because it varies based on where the facility is and the skills the facility has and the equipment that they have available. And there's different levels of facilities. It gets.
I think it's interesting the way you phrased that, and I think you did it on purpose because it's your job. But it's the equipment they have available, not necessarily the equipment they used.
It's the equipment that's available. So, for instance, UAB is as expensive as it is because they're going to have all the latest and greatest toys.
Right.
You go to Shelby Baptist, and people avoid Cooper Green for a reason. Their equipment probably hasn't been updated in 20 years. Shelby Baptist, maybe 5-10-year-old equipment, but UAB is always going to have the latest toys, the latest gadgets, latest training on everything. So of course they're going to be the most expensive. I just got my first hospital bill from a 4-day hospital stay, and the provider fee alone, my out-of-pocket was $3,600. That doesn't count the facility portion. So yeah, and there is a difference between the provider charges and the facility charges, and that's by law. And one reason is to make sure that the hospital does not get more money than what they're entitled to. So you can't really combine the two together because it's a check and balance. It's how they quickly identify fraudulent billing between the two sources.
Jump into that a little bit more if you can, because I don't follow that train of thought at all. So
that's all right.
Yeah,
Give me a minute to my air conditioner just kicked on. I got a vent right over my head.
No.
So hang on.
You're good.
So whenever you have services done at a hospital,
right,
there's actually 2 different bills at least. At least. There's going to be the bill from the provider who renders the service.
Okay.
He's the one that actually goes in and does the actual procedure.
So
he does the work.
Like maybe the physician or the actual.
Yes.
Yeah. Okay.
So like, let's say you've got to have a heart cath done, like I did a few months ago. The doctor who actually goes in and shoves the wires through your vein to bust up clots and stuff like that, he's doing the work. He gets to bill for some of the work. Okay.
Right.
He's the labor. The facility, the hospital, gets to bill because they are providing the space, the sterilization, the support staff, and the equipment to make the surgery possible.
Okay.
So they get to bill for that portion, not the labor, but
well, not the physician's labor, but the support staff and things like that. They're billing for that part.
It's built in. We'll just
Yeah, but
say
I mean,
for layman's purpose, it's built in.
Yeah, but it's technically in there. Yeah. Okay.
Yeah, it's technically it's called a pass through.
Yeah, it's like a salary versus hourly wage. Like it's just, hey, we're doing a thing for you, regardless of that.
It's an understood financial occurrence. Yeah. So it's built into the fees that they bill to the insurances. Then in most cases, I was not so lucky to have anesthesia, but if you have anesthesia done, that's a third bill, because anesthesia is a very, very delicate specialty. They do a lot of extra work that a lot of specialties don't have, because if you give somebody too much anesthesia, they're not going to be around.
They don't wake up.
Right.
Yeah. Okay. So we've got three bills so far. You have the main technical work that was done, the support staff, and the environment, the structure.
You've got the labor. So think of it like a car. You've got the labor bill.
Yeah.
You got the parts bill.
Yep.
And you got the special handling bill.
Okay. All right. And then
so that's another reason why the transparency thing died so quickly, is because there's so many levels. It's not just one straight shot. There's so many levels to it, and unfortunately, it's designed that way on purpose to spot fraudulent billing. For instance, I just read an article from the DOJ about a Florida man who managed to defraud Medicare of $1.2 million over a 2-month period. Unfortunately, when he tried to flee to Cuba, his jet ski died, and he was retrieved by the Coast Guard. But they were able to identify quickly, okay, there's a problem here, and they were able to follow the breadcrumbs to determine that it was him.
Yeah, I mean, this is getting into that's a different angle of approach for the discussion, so it's probably not appropriate for right now. But okay, so we have our main pieces, but then you were saying there's also a 33% that gets tacked on, and that is the insurance.
That's
provider.
A cushion. Because hospitals are not going to change the prices from year to year to match the contract changes from year to year.
Okay.
That's another reason why they charge a third higher than their highest paying contract.
Right.
Okay. So that, let's say this year Blue Cross Blue Shield is paying higher, then they get that higher amount.
Yeah. So,
because if you only charge $5,000 for a hospital stay, but Blue Cross is going to pay $6,000, again, we only charged $5,000, right? Blue Cross is only going to pay the $5,000. There's no contractual, we're going to pay a flat rate no matter what. That's not how they work.
So that pricing structure is that is that governed internally through insurance and the hospital systems, or is that a part of each state's laws, or is that a federal situation? Do you know?
It is an individual contract negotiated between the facilities and or the providers.
Okay.
And the insurance in question. That's why you hear about it on the news when, for instance, UAB right now, they are not in contract with, I believe it's Cigna or Humana. I think it's Cigna. Okay. Because they had a falling out over the contract.
Okay. So is there no, people don't like the word, but is there no regulation around that at the state or federal level for how those contracts get handled?
Unfortunately, no, not when you're dealing with private insurance. Now, there is to some degree, when dealing with Medicare and Medicaid.
Right.
Any and all providers and hospitals in the area, basically, if they want to participate, they have to be registered with Medicare and Medicaid as part of like an oversight committee. Right. Now, providers can eventually opt out of Medicaid if their state allows. Not all states allow. For instance, Illinois, you are not allowed to opt out of Medicaid. If you are a provider in the state of Illinois, you have to accept Medicaid. In Georgia, however, some specialties are allowed to opt out of Medicaid, such as obstetrics, because they cover so little when it comes to obstetrics care. Okay. You're going to have a really hard time finding an obstetric provider in the state of Georgia that accepts Medicaid.
Are you because you jumped on from TikTok? Are you here in Alabama or are you in Georgia?
I am currently living in Alabama, but I
Okay.
have lived and worked in Georgia.
Yeah, no, I'm curious about more. I'm okay hearing like some external perspectives for like Illinois and Georgia, but it's more about like what are we doing that we can focus on.
Right.
So,
But
like,
at the same time, it's a good, especially when dealing with Medicaid expansion, it's a good idea to kind of look and see what other states are doing to have an idea about, well, I definitely don't want to go there.
Right.
So
But
what can we do that's better?
Yeah. So what? We talked about Illinois and Georgia. So like, what is the situation with Alabama? Can people opt out, or do they? Or it sounds like they can. I mean, if I had to guess.
I have not personally heard of providers opting out in Alabama. That's not to say that it doesn't happen. It's just I have not heard of it yet.
The only reason I say that is I was on a radio show, and I'm taking this person at their word. It was radio shows, so they called in, but he was a physician that I mentioned wanting to expand Medicaid, and he was like, well, that's all great and dandy, but that doesn't mean that they'll get access because not everybody takes Medicaid. And I was like, okay, well, that's just something else we have to add to the list. Then is like, maybe it's what you're talking about. It's like, no, you don't get to opt out. Like if you're going to be a provider, you have to accept Medicaid.
Okay. Well, I have not yet heard of it, but I've only been working with Alabama providers for a few years. I have more experience working on a broad spectrum, if you would. I have dealt with providers in California, Oregon, Georgia, Mississippi, Alabama, touched a few up in the New England area. Illinois was my biggest provider that I worked on. That was a Charlie Foxtrot. So I'm still learning Alabama a little bit. I've been working in Alabama for since 2020, actually. So if I triggered the pandemic, I apologize to everybody here.
So it looks like there's a Medicare.org, and there's a way to on Medicare.org. Not that the page exists. That's
okay. So Medicare.org is not the actual Medicare website.
Medicare.gov. Sorry, .gov. I got letters.
Okay. Well, okay.
It's .gov, but
you have to be
there's a way to
careful
find
because
out
one of them
if
is
people have
spam.
opted out. Yeah. No, it's .gov. There's a way to find out if there's providers who have opted out of Medicare. So I'm going to put that in our notes to look into if you can search by state, and that way we can just confirm.
And just in case anybody wants the information, because it doesn't really come up very often for the beneficiaries of Medicare or Medicaid, but the agency that oversees them is called CMS. It's short for Centers for Medicare and Medicaid Services. And they have their own official website as well. So if you want all kinds of goodies, you'll have to speak a little bit of legalese, but.
You said it was CMS, and what does it stand for?
Center for Medicare and Medicaid Services.
Okay. Somebody mentioned TikTok. Taylor, did you see that?
Which one?
No, somebody mentioned about a friend of theirs has Medicaid, and there's people that
yeah, don't take it.
Yeah. So evidently you can opt out in Alabama.
Well, you can also you can also how can I explain this? You can snooze, basically. You can say, well, we're not taking any new ones right now. We're not taking any right now. And I commonly come across that when a provider who's like the designated Medicare person or Medicaid person, maybe they're out over the summer vacation with the kids or something like that. I've seen that happen several times. And I'm sorry, we don't have room for any Medicare or Medicaid patients right now. Can we look at scheduling you next year? That they are allowed to do because they still have to have like a certain percentage of their patients be Medicare in order to practice. But if their Medicare person or what, for example, is out of the office and everybody else is full of patients,
so
they can kind of like snooze it.
So what it sounds like, because again, I'm like, this isn't that's why I'm trying to bring people in, because this isn't my area of expertise. It sounds like you're saying an office can have, let's say it's 10 physicians, and in order to be a practice that offers Medicare or Medicaid, one physician can be the one that takes that, and nobody else has to. Is that?
Well, it could be, no, it's more like, how do I explain this? Okay. With an OBGYN office, obstetrics and gynecology,
Yep.
you'll have maybe a provider that specializes in high-risk pregnancies. So it ends up being where pretty much 98% of her patients are high risk. And she's fully loaded right now. She cannot possibly take on another patient at this time.
Right.
And that's across the board. And let's say the provider that's been working for, 40 years, all of his patients are Medicare aged. Well, he's going out of town for the holidays. Let's say he's going out of town for the holidays, and he's not going to be back for a few months. So he's not going to be there to accept any new patients.
Yeah, but so it's not. So I guess that's why I wanted to clarify. It sounded like you were saying if the person who accepts Medicaid and Medicare is out, the practice may not be accepting new patients. But it's not that the other doctors don't accept it. They are also potentially full, and that person's not there.
Right, because a lot of times, like for instance, let's take a look at our two providers, the 40 career long provider versus the high risk pregnancies.
Yeah.
There's going to be older women that are going to say, well, you know what? He's been doing this for 40 years. I'm going to trust his opinion over this person that's only been practicing for 10 years. And that's another problem that they run into.
No, I was just trying to clarify. Like, so if
sorry,
no, it's okay. And I'm trying to wrap my head around how some of this works, because it is so, for a layperson, is convoluted at best.
Yes.
If you have a practice, is the insurance coverage, and maybe it changes per specialty, but let's stick with OBGYNs. Is the coverage for a provider, so whether it's Blue Cross Blue Shield, whether it's Humana or Cigna, or pick a United Healthcare or Medicaid, is the provider acceptance office-wide, or is it physician-specific?
Depends on the contract with the insurance. Blue Cross Blue Shield
through that.
So with Blue Cross Blue Shield of Alabama,
yeah,
the providers have to have individual contracts.
So each physician in this case.
Yes.
Gotcha. Okay, so it's physician specific. So if you have a group of 10 physicians.
Only for Blue Cross Blue Shield of Alabama. Now, if you turn around and talk to Cigna Health Spring, which is a Medicare Medicaid plan, it's one of those all-in-ones, they're going to tell you it's by practice.
Gotcha. Okay.
So it depends on the contract holder.
Okay. So when you say contract, you mean the insurance. So we need to get terms correct. So we have healthcare providers, and that would be the individual physicians for a blanket
Yes.
statement. What is the proper term for the insurance? What I would call an insurance provider. Like, what is the proper term for that entity?
Insurance provider, or you can call them the payer. More often than not, they're called payers.
Okay.
But as far as the special relationship between the insurance and the provider or the hospital, that special relationship is called a contract.
Yeah.
It is an actual written down contract. Both parties have access to it.
Yeah, because they made an agreement on how much they'll pay for certain services and things like that. That makes sense. I just because it gets really complicated for lay people to understand.
Yes.
When we are talking about,
It's complicated for us too, because this is one of my books. This is my smallest book, and that's about 2 inches.
TikTok can't see it, but it's this thing.
Hey, Jared.
Yeah.
Can
We have
you
like 5
repeat?
minutes, right?
Yeah, there was a question of the website that you mentioned.
I had
CNC.gov.
Medicaid. I had Medicaid.gov. Fried.
CMS.
You had, but was it a website or just the name of the organization?
It's both.
Okay, so CMS.gov.
CMS.gov. Is that what you needed, so girl?
You can actually just Google CMS. But it is CMS.gov.
Okay, CMS also means different things depending on what your personal search history is. So it may not just no. In web development, it's a content management system. So like,
But
there's lots
CMS,
of
they
ways.
paid a lot of money to make sure that they are at the top of every Google search.
Gotcha. Okay. Yeah. So it is the first It is the first one on mine, but I've also been doing healthcare searches recently. So, but yeah, CMS.gov and Medicare.gov. Cool. Okay. We only have a few minutes left, so like this has been it's been an insightful meeting. So I appreciate everybody's time. We do these every Tuesday at 7. For the foreseeable future, we'll be doing these. So it may not be healthcare every time, because ideally we're going to get some stuff to chew on and look at, and then we can do some research in the back end and then come discuss it at a future meeting. So next Tuesday we may focus more on education. We may focus more on the prison system and trying to solve that problem. If something else happens that is timely, we may end up talking about that. I'm hoping there are no new surprises in the news that we need to talk about, but if they come up, I will happily talk about them if they're going to affect the people in Alabama, because like you guys need to know what I'm thinking, and let's find a way to move forward through whatever is changing in our lives. So whether it's Alabama causing it or it's just impacting us, we'll talk about it if it's timely. So. The next meeting coming up is we have 2 on Saturday. We have a campaign strategy meeting at 9 a.m. Central, because we're all in Alabama. Well, the people that are usually participating are in Alabama, so all of these will be Central Time. 9 a.m. till 10 will be campaign strategy. And then we will have a field organizing meeting directly after that from 10 to 11. We will probably cut the first meeting short slightly so everybody can take a bio break and come back and be refreshed for that second meeting. But strategy is literally us figuring out what our next steps are as a campaign to try and get more attention. So similar to the video that most of the people that are in the chat, I hope, saw, where I was being snarky and calling out somebody who was like, "You should look more professional and trim your beard," and I was like, "No," like that's campaign strategy stuff. It's like, what are we going to talk about? What are we going to focus on? How are we going to try and get in front of more people? And then field organizing is boots to the ground stuff. So we'll be talking about canvassing, talking about going to events. I know people earlier in the chat were asking about that. That will be Saturday at 10 o'clock. So if you're interested, check out the website. Just like
and also find an event for us to come to.
Yes. So ideally,
find
an event for us to come to first, and then join the field organizing meeting to tell us all about it and have come up with a plan for me to go there. And I heard World Games. My problem with going to events like that one specifically is most of the people that will be there, from what I gather, aren't going to be Alabama residents. They're coming to see those events from outside state. So I don't know that that's the best use of my time. Unless there is
Lionel Richie, I think, is doing either the opening or closing ceremony, so they're expecting a large turnout of locals.
Okay.
Yeah, because it's his first time in 40 years performing in Alabama.
Gotcha. Okay. Well, I think I'll have to see if I still have access to tickets, because I do for some other reasons, but I may be able to make that happen. We'll see. Yeah, events like that, the more advance notice we have, the better, so that we can plan for them. And then a part of that, and it's the shameless plug of this before my meeting time runs out, donations. So, if I want to go to events in Birmingham and Huntsville, and, going up to Northeast Alabama to, was it Calhoun County? I can't remember where the person was in the last live stream. That costs money. So I've got to have
because Hotel de Professor Gemini is expensive.
Yeah, if I'm not going to Hotel Professor Gemini, it costs money. So, and my meeting ended. So TikTok, everybody else just got dropped. I'm going to end the live everywhere else. Everybody have a good day. We will see you. We'll see you in a couple of days.